everyone, welcome back to my channel. My name is Jacqueline and I'm here again with my amazing surgeon, Dr. Beck.
Hello everybody.
So in this video we're going to be focusing on the very first surgery I had done and kind of answering all of the questions, recovery, pain, scarring, and everything that we did to remove the excess skin.
So the first operation that I performed on Jacqueline is called the Corset trunkplasty, and I learned this through Dr. Alex Moya, who really is a pioneer in weight loss, skin removal, and what it really does, it's a way for me to focus on trying to remove as much skin as possible in one surgery, and that's going to be focusing on the lower or the torso. So in our first operation, I was able to remove essentially almost all of the abdominal skin that Jacqueline had because she has so much. And that requires multiple incisions. It's not just an incision down low as like an abdominoplasty or a tummy tuck incision. There's also a vertical component because not only when you were heavier was the fat distending you out this way, but it was also distending you out this way. So it requires different vectors of pull to be able to remove all that skin. So there was an incision that went under her breast. There was one that went down low, like in the bikini line. And then there was a vertical scar. And actually one of the incisions, the one down low, went all the way around the backside.
Mm-hmm. So it was like all the way.
Yeah, that's right. And
so why did we choose to go and do this one? Because I know a lot of people just do all the way around and they choose not to have. Is that because, like you said, it's round?
Yeah. I mean, this because, you know, the fat distribution, when you're heavier, you're pretty much making skin to accommodate all this extra fat. And it's not just in one plane, it's in different planes. So we have to remove skin, not only this part down below that was hanging over, but also this part that we can pull together towards the middle. And this technique of the corset trunkplasty is really useful because it doesn't undermine the skin as an abdominoplasty would. So I have in the past done like an extended type of abdominoplasty for massive weight loss or skin removal, and you could have problems, or I had problems with the healing of the tissue, wound healing, because the blood supply wasn't as good as it should be. But with this newer technique, the blood supply to all of the flaps, all of the skin that was remaining was excellent, and Jacqueline healed, I'd say, almost faster than an abdominoplasty or a tummy tuck. So she looked amazing right from the very get-go.
Mm-hmm. I remember looking down in the hospital after like I woke up and seeing it like flat like that. I was like crying for like a week because it was like flat. So I know a lot of people are worried about the scar going up and down because you can't hide it as well. But I think for you just have to decide what you want or what the results you want, because like we discussed, because I know I was nervous about having like a big scar go up and down. But like we talked about, is it's going to give much better results and get a lot more of like the skin away by doing it like that.
Yeah, I mean, I've had now numerous patients where I've done massive weight loss or skin removal surgery on, and most of the people really don't even care that much about where the incisions are. They're just happy to have a much more contoured shape. Mm-hmm. So this is really a method to provide as best contour as possible so you can wear, you know, a nice fitting, you know, tighter outfit or shirt or dress or just shirt for a man and be confident that you look really good. As far as the scars, some people scar absolutely beautifully like Jacqueline does, and some people don't. And that's really dependent not so much on the surgeon, but on the patient's inherent ability to heal.
Mm-hmm. And I also think it's very important to do your research and find a certified plastic surgeon for this, right?
Board certified plastic surgeon.
Right.
Somebody who's done a number of these types of cases, somebody who's willing to kind of go the distance with you, because this is not just one operation. This turns out to be multiple operations, as you can see from our experience, Jacqueline and my experience.
So can you talk about kind of, I know I get asked, like, people don't know anything about skin removal, and so like on the stomach, how do you cut like a circle out? How do you remove it, kind of?
So I think it's important to understand that once you lose weight, all of that skin that you made to be able to encompass and live now becomes almost like a Shar-Pei dog, right? The skin's super loose, and we have to remove it somehow. And it's a big operation. I think that this type of surgery is very individualized for patients. I think that's important. And we do it differently depending on different patients. But the technique that I described, called the Corset trunkplasty, is an attempt to try to remove as much skin as possible, maintaining the best blood supply to the skin that remains as possible, so that way you heal really well. And that, in this case, requires an incision that's low, that's vertical, that goes underneath the chest or the breast. That's stage 1. And then after you go and you heal from that operation, then we go on to typically like an upper body lift. And we could talk about that too.
Mm-hmm. So once you cut then you pull this way and sew it, and this way?
Yeah. Okay, so if you really want to see it, basically you're laying down on the operating room table, and we literally take forceps and we pull the skin to the middle, and we estimate how much skin we remove. Once we estimate that amount of skin, we measure the skin amount all the way down towards the pubic area, all the way up to the xiphoid. And then after we do that, we make an incision and literally, and around your belly button, and we literally remove all that skin. And then we take the skin edges and we reapproximate them at the midline. That's stage 1. Stage 2 would be, or step 2, would be to lift the skin here and make an incision underneath the breast, so that way we could pull the skin up on each side. So that's where we remove like a crescent of skin underneath each side of the breast. And then lastly, we have to lift the pubic up, because it's very common for the pubic area, the genital area, to really fall down after surgery. So we have to relocate it back up, and that means removing a bunch more skin of the lower third of the abdomen.
Mm-hmm.
Yeah.
I know I was talking to someone at the gym, and they're like, this is going to be maybe a stupid question, but I don't even know how you remove the skin. Like, how do you cut it off? Do you just hold it out and cut it? Or so there's a lot.
Yeah.
Yeah, so I wanted you to explain it a little bit.
Yeah.
As far as, I know everyone's different, but for me, in terms of drains, how did I have, and where were they? Do you remember?
Typically, I use 2 drains, unless I go all the way around your torso. So if I go all the way around your torso, I'll put 2 drains in the back side to drain. Your body after surgery secretes this fluid, and rather than keep it trapped underneath the skin, we put these drains in. And the drains are like this elastic tube that we then place underneath the skin, and we hold them in place with little sutures on the skin. And so I put 2 in the back side and 2 in the front side to remove that fluid, so that way everything heals and sticks down accordingly.
And I know for me, they didn't hurt. They were kind of annoying to have, like, in your body, but they didn't hurt to come out. Or...
Yeah, everybody gets nervous about removing drains. Well, the older style drains, called the Jackson Pratt drain, when you remove it, it would really hurt. Now we use these drains called, oh my God, they're round channel drains. And when you remove them, you may feel a little bit of a tug, but nothing that even hurts. So you should be relieved, or maybe ask your surgeon about those. Mm-hmm. Yeah.
And then last part of this is, what's recovery like? Like, how long do people need to take off work or can drive again for this surgery?
For this surgery, I would say taking off 2 weeks from surgery. 2 weeks off from the initial operation until you're ready to go back to surgery. And that's going to be enough time for you to, get up around the house, start, taking care of activities of daily living, taking a shower, the pain medication. You switch from like a narcotic pain medication that helps to like maybe Advil, if you can take Advil, or Tylenol, or other various types of remedies.
Yeah, I think in like 5 weeks, I was completely back to normal. I wouldn't have even known I had surgery.
Yeah. So
2 weeks.
I say 2 weeks to go back to work, but it does take time for you to really heal all the way.
Right. So I hope we answered some of your questions about the very first surgery I had, and a little bit more about the body lift, the corset trunkplasty, and why I decided to go all the way up and have the vertical incision as well. So thank you, Dr. Beck, for answering these questions.
Thank you for inviting me.
Yes, and if you guys have any other questions, please leave them down below, and we'll be sure to go into more detail of all the other surgeries I've had and what we plan on doing in the future together. So thank you so much for watching. Make sure you're subscribed, give this video a like, and we will talk to you guys soon.
Bye-bye.
Bye.